Okay. So this is being recorded, and let's see. I don't see any attendees. Let me broadcast. Hold on. I'm not seeing the broadcast button. Sorry. Jennifer, I'm going to make you a co-host and see if you can see.
Is it a meeting? Well,
It
yeah.
says it's a webinar.
Oh.
So, and usually I've never had, it's usually just, oh, you know what? I think it is just broadcast because I didn't set up a practice session. That's why.
Oh, okay.
Yeah. So people could join us if they happened to have, noticed that we were having a meeting and decided that this was a pressing matter for them to attend. So we do have to say the statement. Don, do you have it in front of you, or do you want me to just say it?
You go ahead and say it.
Okay. The committee chair determines that an in-person meeting is not practical or prudent because of the statewide COVID-19 disaster. And this meeting is being recorded.
I think our first
So, yeah. So we have, I'm going to actually type into the chat, so just ignore it. It's just how I'm going to take minutes with that so that I can still see you all on the screen. So we have everybody here. And the reason that we're here is because the COVID-19 restrictions were reduced to phase 1 for our area, for Region 5. And so we need to figure out how, as a library, we can respond to that, whether we want to, how much we want to open up and what kinds of measures we want to have in place in order to do that safely, if that's what we want to do. I did have a couple of conversations with staff today, and also got an email back from one staff member when I asked them for their thoughts. And the consensus among staff seems to be like that this is not going to last for very long, because SIU is going back into session this week, and probably we'll have another surge in about 2 weeks, and things would have to be shut down as well. So people are kind of concerned about the level of safety for opening us up. So that's the concern from staff. And then I do have a potential thing to propose, and the staff who were present today liked the idea, thought it was doable. Currently, we are allowing in one person every half hour, and that's for non-entertainment computer use only, and everything else we've done curbside. And I'm finding that we're serving about 10 people a day tops in person. So there are still slots open, doing it that way. And when people come in, we have them sign in, and we reiterate the rules to them about wearing a mask and not eating or drinking, and just following the rules in general. And we have just 4 computers open. We have them take a little slip that says "clean me" to leave on their computer after they've used it, so we know which ones need to be cleaned. So my thought today was potentially to use the same schedule, but to broaden it to any whatever use people want to come in for. They can make up to 3 appointments per week, and they can come in for a 90-minute appointment. And it doesn't have to be for computer use for non-entertainment purposes. They could come in to browse stacks. They could, come in to use the computer for whatever reason they want to. And it would be one individual or family every half hour for the appointment. So if someone did want to come in with their kids to browse the stacks, they would be able to do that. Our social workers are back also. So I think that by doing that, we would bring the staff, right now the staff's on a sort of a restricted schedule. I'd bring them back on their normal schedule so we can more fully operate serving the public. And I'm guessing there might be maybe 10 patrons at any given time in here if we do it that way. And it should reduce the difficulty that we had when we were simply open of, people walking in and then going and finding their seat and just, pulling their mask down and that kind of stuff. So any arguments that we need to have about mask use, we would be able to have at the door. So that's my proposal for getting us reopened. I don't know. I want to know your thoughts on whether you feel like that's enough access, or whether you like that idea or you would amend that idea in any way, or if you would prefer to just see the doors open. What are your thoughts?
Have you had people waiting for appointments?
Not typically. A couple of times, someone has come, someone might come 15 minutes early or 15 minutes late, and we'll just let them in. I had one person call me on Sunday and say, they were supposed to be there half an hour ago, and he said, can I come in the next 15 minutes? And I said, sure. I mean, we could throw one more person in,
Right.
So I haven't seen a whole lot of that. There have been occasions where, someone was doing curbside faxing and printing, and what they were doing was rather complicated. So we just let them in the door. But when we do it this way, this way, it allows us to have that interaction with them rather than having them just walk in. So.
Where were we when we were at last at this level from the guidelines? What were we doing at that point?
When we were last at this level, well, that's hard to say because this level hadn't been created at that time. They changed the system. So we were brought to, there are phases and there are tiers, and the tiers didn't exist. And now we're in a tiered system instead of a phase system.
Okay.
I probably about the closest that we were, we did have the doors open. We had a lot of problems. We banned a lot of people.
I mean,
Jennifer's raising her hand. I think she wants to share something.
I just had a question because I saw a letter from the ILA about trying to advocate for libraries to get up higher on the list of vaccinations. Because it kind of seems like if all the places that are completely open are they're on the schedule getting vaccinated pretty soon. And if we're not up there, I don't know, that gives me a little pause, but I was just wondering if we had spoken to them at all or knew what their thoughts are.
Yeah, I'm on the ILA board. So I got an email today from IHLS that said that even though ILA is advocating for us on the state level, that they recommend that we advocate on the local level, because so much of what has happened with libraries throughout has been that the state has really refused to categorize us in any way and has left us to local control. And that's largely because of all of our past work with ILA. We always ask for local control. So they didn't categorize us. and allowed us to decide what we wanted to do and coordinate with our local health departments. So, so IHLS suggested that we write to our local health departments and ask to be moved up. So I did that today. So we have advocated for ourselves with Jackson County Health Department, and hopefully they will add us to that list. And we shall see. Right now we're not in a category. And so unless our local health department decides to declare us as such, then we're just the general public, and then it will probably be April. And I would feel a whole lot more comfortable opening the doors to the public if our staff were vaccinated, or at least had the opportunity to be vaccinated if they wanted to be. So, because then I feel like people who come in, they know what their risks are and they're choosing to take those risks. But as long as I have to, as long as it's going to weigh on my conscience, if any of my staff have, permanent disabilities or lose their lives, or, lose family members or anything like that, then it's, then they're my main priority. So that's where I'm at. Other thoughts, questions?
Well, I have a question. You seem to think that, or at least staff seem to think that this is only a temporary thing because of students being back. Can you elaborate a little more on that? I didn't follow that.
Yeah, so there are 3 measures that the state is using to decide what tier we're in. And whenever those change, then that will automatically push you into a different tier. So there is never a lot of warning. So the 3 measures are available hospital beds, a decrease in your positivity rate, and a decrease in your overall number of people who test positive. And that's over, with each of those measures, it's over a period of time, like 3 days of being in a reduced category. One flaw in this is that, we have more COVID cases right now than we did the last time we were in this situation. But, we have less today than we did 4 days ago. So we were able to do the opening. So their concern is that what you see, and really this is true nationwide, is like the more things are open, as soon as they open, then you get a swell of cases, and then you end up shutting back down. So after Halloween, there were parties on Halloween weekend, and then people got sick, and then within 2 weeks, everything shut down. So when they reopened the university and they reopened the grade schools and the high schools, so right now everything looks pretty good, and that's because people haven't been in school, and so they haven't been exposed. So now that the schools are reopened, probably will get that exposure again, and in 2 to 3 weeks, those numbers will be rising, and they will put the restrictions back on. There are
It's not a countywide decision. It's the whole area, isn't it?
It's region, yes. Yeah, it's a region. So, and we can even so we could be doing poorly in Jackson County because of that. But if all the other nearby counties collectively, are doing well, then that's going to keep us in that open slot. It's an average with that entire region. They do show the statistics for each county, but yeah, we are basically lumped into a region, and our region is probably doing well because it's fairly rural, so people don't have that much interaction with each other, and so that's their concern, is that if we open it up, it's going to we're going to open ourselves up to cases right when cases are going to begin to climb again, and then we're going to end up shutting down. There are 3 restaurants, Thai Taste, Kahala, and Hunan, and perhaps others that said that they're not opening their doors, even though they can, that they're still doing curbside. Probably with that same thinking in mind, their staff is like, why would we do this and expose ourselves, and then we'll be closed down in another couple of weeks. You know, with their staff, they are probably, as long as they're doing curbside, then they're not going to have to close their restaurant because they're not going to get a case. If they get a case, then they're probably going to have to close the restaurant, and then they all lose more money. So they're remaining curbside. So that's
Well, I thought I understood from the governor's speeches that I heard that he was abandoning the one of these criteria that you identified, which are on the website. I thought he was getting rid of the bed count that he was talking about. Am I wrong
he
about
may,
that?
I don't know. That's a good question. He may have done that. And that might have been, because that was actually the measure that we were not meeting.
Well, it sounded like he was doing it because he was trying to help things in Chicago. So he could open up restaurants and other facilities that people were obviously maybe not in non-compliance with his desires and whatever, and he was trying to make it work. But I thought I understood him to say that but he could change this tomorrow again. We understand that, but I thought he understood what he said on Friday was that was no longer going to be part of his criterion. So it's not on the website. I already checked that, but
okay.
I didn't understand whether that's the case or not.
So he did take it off of the website?
Website still has the same 3 criteria you were talking about, but
Okay.
I thought he said in his press conference that he wasn't going to do that, which this is the kind of thing, it makes it very confusing for the public, where we've got shifting definitions of what is what. And as you point out, we've got a whole new set of determinations. We're talking about phases and tiers and who can tell what from reading the way they present it. I agree with you that we shouldn't be fully open at this point, even if we could be. I think we'd open up to 25 the way I read his criteria, but we wouldn't want to do that when we still have staff that are still vulnerable to this. In the event that you get them tested, they get their vaccines in there, it's still a month after this process is finished before they're immune. So I don't see us doing anything before March at any time. I mean, no matter what. I would think that your suggestion is a little restrictive in how many people were you going to let in? One family at an hour?
Every half hour.
Well, it seems to me that's rather restrictive for the community. Can you not manage 3 or 5 people at a time, or is it just too much to work with?
I could change the I could adjust the appointment schedule. It's right now it's not filling up. The only the thing to keep in mind with adjusting it is just that you still want to stagger them so that they're not piled up behind each other. So
Well, the idea of the appointment, I think that makes a lot of sense. And in fact, that's what his thing says about in restaurant eating, that you have to have a reservation to come in and do it. Whether they're doing that at the few restaurants that have been operating or intend to operate, I don't know, but that's what his guideline says. But I think your appointment makes sense from a management point of view. And I certainly agree. I'm thinking the whole committee would agree that nobody should be admitted who's not going to understand the rules that they have to wear masks.
right.
And if they're not interested in complying with it, then they need to go to Morris, right?
Thanks.
Well, you haven't been bombarded with requests for appointments, so I can't
Right.
see that that's going to change that drastically in the next couple of weeks.
Mhm.
and we see how things might change when the students are back in town. And so I think I'm with you, Don. I think we can stick with your recommendation, and unless you want to just slightly up the number of people you're allowing in at one time, but
What
whatever.
is your capacity level?
So it depends on which measure you use.
Right.
But if you're using, I believe it said if you were using your 25% capacity, then you could have your staff here and 25 patrons. It's about roughly kind of what it, just based on our square footage.
And have you ever had 25 people in there?
When we were open, when we
Right.
just had the doors open, then at times we would.
Okay.
So it's, and we did have a hard time occasionally getting people to follow those rules. We had, we had said no unattended children, but hey, if you just dropped your kid off here, what am I supposed to do with your kid? Like, so the kid's in here. So, and if you're not coming back for 4 hours, well, if you just went to work or something, how am I supposed to get your kid back to you within 90 minutes? So things like that. People not wearing masks, people arguing with us about it, and that kind of stuff, which is really the to me the most vulnerable situation, because it puts a lot of stress on the staff. But it also, if you're having to have an argument with somebody about wearing a mask, then they are shouting and they're tending to get close to you, and so
Right.
they're tripling your exposure to them without their mask on. So yeah, so that's where the appointments, and it's difficult to have somebody stationed perpetually at the door, which is if we space it out so that there are several minutes in between, we don't have them piling up on each other, but we also don't have someone whose whole job is just going to be to sit there at that door all day long. And then they can't get anything done. If it's an appointment based, we go and unlock the door and we let them in. And then that's the other thing, and I probably shouldn't admit this, but the door is locked behind them. So it's an easy door to unlock, but you don't probably want 20 people in here with the door locked.
I don't even know if you can do that for purposes of fire protection.
You're right.
Don't go there.
Yeah.
Well, I'm curious about that. As a public building, I don't think that you can have, unless it's allows for emergency exits, I don't think those doors can be locked.
Yeah. So that's another issue with it too. But there is a back door. People can go in and out the back door. So.
Well, and it has completely cut down on people, like the mask compliance. I mean, there's still an occasional, but it really, like, people have to sign in and out, and just having that accountability. Plus also people keeping track of how long people are in is much easier when there's the sign in and out, because we had a time limit, but it was really hard to know exactly, like, when did that person walk in. And so
Right.
people would be hanging out for much longer than they were supposed to be,
Yeah. Yeah, it was really difficult to track that.
Yeah, and they tended to go in the front door and out the back door, back in the back door, out the front door, and then basically hang out.
Yeah.
Well, let me just ask the committee. I think there's a consensus of the general approach that Diana was suggesting, and along with her staff. Do you want to just take it as she proposed it, or do you want to suggest any change?
I'm
I'm
fine with
with
what,
Diana's proposal.
right, me too.
I would
I can
suggest
see
that
if
we do
we,
that. We go ahead and have another meeting in a month to see how things are going.
Right.
Okay. And I can see how, if putting them at the top and the bottom of the hour, like we are currently, if we have a lot more demand than that, I could adjust it to like every 20 minutes maybe and see if that helps to allow in a few more people.
Well, I think you have the latitude to do that without any further immediate meeting of the committee, but
Yeah.
you know, this is all wearing on everyone. And it's not like we're back in March thinking, well, it's going to be over in 2 weeks. So I do think we have to find a way. And I think the best thing that can happen is if your staff can get immunized with the vaccine, then I think then we can still, I don't think we just open up widely entirely, but it'll be much more practical. I don't think it's fair to ask your staff to expose themselves to health issues. So, I mean, I think that's sort of my view of it. I see other people nodding. I think they agree. But we are trying to find a way to serve the public, and this is, the governor's not making it easy because it's not easy to do it.
Right. Yeah, I'm grateful at least that we live in a state where there are some, you know, some guidance and regulations in place and some attempt to keep the spread down. I think it would be very difficult if the norm and the guiding principle was to try and keep everything wide open and pretend this isn't happening. So kind of glad we live in Illinois right now.
Can't say that all the
Yeah,
time.
you can. I wouldn't have said that in 2008. So, okay. Do you all, since we are here, want to take a look at your calendars and we can see if there is a good date a month from now to go ahead and have another meeting? Let's see. Could meet. Let me look at our Zoom schedule as well, but I think we have the 16th or the 23rd. Let me see if those are available on Zoom. You'll take a look at your calendars. We could do 4:30 on either of those.
I'd be available either on the 16th or the 23rd.
Okay. So let's see. Let's see. They're both available on Zoom too, so both of those are possible for us.
So which days were you looking at?
Tuesday the 16th or Tuesday the 23rd.
Either one's fine with me.
I think I'm okay also.
Okay. Jen and Lynette, does that sound good to you guys?
Yeah, either one's fine.
Tuesdays are fine.
Either one?
Either one's fine.
Okay. Alrighty, so let's just go ahead and say the 16th at 4:30. And if there isn't anything further, Lynette, was there anything, you haven't spoken much, is there anything you wanted to say or?
No, I mean, you know, what we talked about earlier.
Mhm.
Because, you know, the people naturally think that just because they said mitigations and restrictions are loosened, then they think everything's wide open, which means everything's wide open, which means everything's wide open. I don't have to put a mask on. I don't have to do it, which
Yeah.
is not true.
Yeah, I think that people too might be confused for a while about why they still have to wear a mask if they've been vaccinated. They're still, as far as we know, still potentially carriers. So I think that that's another point of communication we may have to get used to intercepting as well. So that'll add to that non-compliance. So, okay, we'll move forward with that and add time slots if needed, if we're finding that we have more demand than we can meet. And we'll have another committee meeting on February 16th at 4:30. I don't have anything further if you're all ready to adjourn.
Who's
Didn't
working
take
at the
any
CERT
votes, 'cause We
desk?
have nothing to report it other than we discussed it, I guess.
Yeah, that we discussed it, where we have a plan that's not a policy. It's just guidance and can be adjusted if needed, but we'll go ahead and keep things at appointment only, but open up the reasons that people can come in and open it up to families as well as individuals. So. Susan, were you going to say something else?
My question was, who's working at the desk right now?
When
Patrick, yeah, Gwen and
So I'll be
Patrick.
over there in like 5 minutes to pick up my book that's on hold.
I will warn them.
Tell them that you need your Christmas present.
Oh, that's
too.
true. That's true. Okay, this is
I'll
exciting.
bag it up personally.
Oh, thanks.
Gotcha. All right. Well, thanks you guys so much. I really appreciate your time. It's much easier to make these decisions when it's not just, me making these decisions. It really does help to get input from the from board members and staff as well. So thank you. Much
Glad
appreciated.
we could help.
Okey
Stay
doke.
healthy.
Thanks, you too.
Bye, everyone.
Good
Thank
night.
you.
Bye.
Bye.